Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. 1 in 10 children will be sexually abused before age 18, and 90% of those victims will know their abuser. Alarming statistics. So what can be done to protect children in our community? The Child Advocacy Center is one organization looking for ways to do just that. Christy Prang, the Training and Prevention Director, is joining me today to let us know about their efforts in the community. Thanks for joining me, Christy.
Thanks for having me.
Now tell me a little bit more about the Child Advocacy Center.
At the Child Advocacy Center, we are a safe, child-friendly environment for children, youth, and non-offending caregivers where there's been an allegation of abuse or neglect. And primarily what we see is sexual abuse. However, we serve severe physical abuse and neglect. We serve witness to a violent crime, drug endangered children, and also a recovery from a kidnapping.
So tell me about the services at Child Advocacy Center.
Sure. So one of the things that we provide is a forensic interview. The child comes in and is interviewed with the hopes that they will not have to retell their story, which will hopefully reduce the trauma. Kind of the heart of what I feel we do is the advocate role, and that really is from day one our advocates are providing support, whether that's resources, really helping them through the process, kind of navigate through the system. We provide on-site medical, we provide on-site therapy, and then we do a little bit of training.
Okay, very good. Now, who are some of Child Advocacy Center's partners in the community?
Sure. We partner closely with Health and Human Services, and we partner locally with the local law enforcement, including LPD, Families Crimes Unit, and then we also partner with the Sheriff's Office.
Now, tell me what the Child Advocacy Center's role is in preventing child abuse.
Sure. So currently right now we are using Darkness to Light Stewards of Children Prevention Program, and so that's focused specifically on child sexual abuse, and so really geared towards any adult in the community. We're getting a lot of school guidance counselors, which is great. A lot of youth serving organizations, foster homes are coming through, but I'm really hoping to increase that parent reach, and so that's primarily what we're doing now, and we host those during the day, at nights. We have one coming up in April on the weekend. Another component of that we've been hosting at the Advocacy Center is a Bystanders Protecting Children Against Sexual Abuse, and so that's really what can we do, and that's really surrounding the language that we can provide adults to really take a stand against boundary violations when they see it. Another component that we just hosted is talking to children about sexual abuse, and so we know that parents have a hard time coming up with language. They don't know what to ask their kids. They don't know what language to use, and so in that training and that education we help kind of provide a framework for that.
So why are these prevention programs so important?
I think it helps mitigate the abuse that's already occurring. I think that oftentimes kids don't understand that what's going on in their home isn't necessarily right, and that sometimes they feel at fault for what's going on. Research suggests that with a history of abuse that it can lead to adult issues. So we're looking at, an increased mental health concerns, increased substance abuse, increased juvenile and adult crimes, and just poor social adjustment. So I think kind of the analogy of going upstream and catching people prior to them at the edge of the waterfall. So we really want to focus on early intervention.
It sounds like very important programs. Tell me, what does the future look like at Child Advocacy Center?
Sure. We're hoping for increased utilization, and really that's fostered by our relationships with our team, with law enforcement, with Health and Human Services, and with the Attorney's Office, because again, we know how important that forensic interview is, and really minimizing the amount of times that they have to retell their story. And I'm hoping to increase our prevention efforts, increase our prevention program, and just start to really outreach into the community and reach more and more individuals and educate them.
So tell me about some upcoming events you have.
Sure. Well, one of our biggest one that we've been working on for several months is the Stand Up for Kids Carnival, and really that's a prevention event focused towards families, and so we are providing food, games, dog agility will be pretty fun, but kind of also a part of that now this year will be prevention efforts, and so we'll be hosting little mini series of that sexual abuse prevention program, so parents can come in and we will provide childcare for them. It's really 15 minutes long, so they can get an introduction into the curriculum. We also are hosting Jenna Quinn out of Texas, who is an ambassador for essentially Jenna's Law, and that puts child abuse and neglect prevention efforts into schools, along with sexual abuse prevention education into schools. And so we're hosting her. She's going to do a program piece really highlighting and empowering, I think, people to move, to stand up and start talking about sexual abuse. She's also going to be part of, and we're going to be hosting a panel, which is going to be, I think, just phenomenal. And what we're going to be doing is 4 survivors are going to come and talk. It's called Becoming a Voice for the Voiceless, which is Jenna's sort of slogan, and they're going to talk and really move, hopefully, participants to, again, take a stand and become more involved in the community.
That's great. How can somebody in the community make a difference?
Sure. I think that getting involved with your local organizations such as ours, hosting and attending these events, I think educating themselves and their children on abuse neglect. I think knowing the mandatory report law is critical, knowing that all adults in the state are mandated reporters. And then I think a critical component of that is breaking the no talk rule. I think that we have to start talking about abuse, neglect, especially sexual abuse, and you know, just providing adults with that language so they can start those conversations with not only their peers but also with their children.
Very good. Now, where can our viewers go to learn more about the Child Advocacy Center and the prevention programs?
Sure. We have a website, www.smallvoices.org, and that will have essentially everything that we have going on, including our training. And then we also have a Facebook page, which I would encourage everyone to look up. We are hosting our event on April 26th, and so that will have highlights for that.
Okay, very good. Well, thank you so much for coming and for all your efforts in the community.
Thanks for having me.
When we return, we'll talk with another organization about how they are helping families.
I've had times that were good, but I've also had some times that were really bad. I was abused and afraid. But the center helped me through this. They helped me learn that things would be okay. I don't know what I will be when I grow up, but I know I'll be strong. I know I'll have a ton of courage. I know these things because of the people around me. You've taught me things will get better. You've taught me fear doesn't have to take over. And because I know you will watch out for me, you've shown me there can be a lot better things to come.
The Child Advocacy Center is the only organization that offers fact-finding interviews and medical exams for victims of child abuse in Southeast Nebraska. In becoming a part of the CAC community, you help children to thrive, not just survive. Help put more power behind small voices.
Parenting can be one of the most challenging responsibilities of anyone's life, especially since there's no easy how-to manual to prepare us for the day-to-day hurdles. With that in mind, Lincoln-Lancaster County Health Department and CEDARS Youth Services partnered up for a program called Healthy Families America to give parents a helping hand. Joining me today from that program are Kodi Bonesteel, the program supervisor, and Janel Binder, a home visitor for Healthy Families America. Welcome to Shape of the City. Thank you both for joining me. Tell me, Kodi, a little bit, what is Healthy Families America and how did it get started?
Healthy Families America is a free and voluntary home visitation program that we started offering at Lincoln-Lancaster County Health Department with CEDARS in 2008. It originally started as a program in 1992 through an agency called Prevent Child Abuse America after decades of research. So it's really a prevention program for child abuse and neglect. We work with families to establish a positive child and parent bond, and work with things like family goal planning and linking families to community resources that they need.
Okay, now who provides the home visits for Healthy Family America?
Yep. We've got 16 full-time home visitors at our program. So we see anywhere between 250 and 300 families at a time. Our home visitors, half are public health nurses and half are community outreach specialists, so more like social workers, but they all do the same role as a home visitor. About half of our home visitors are certified lactation counselors, so they have expertise in breastfeeding. And 4 of our home visitors are either multilingual or bilingual, so that helps a lot when we have families that speak other languages.
Very good. Now, what are some of the positive outcomes you've seen with the program?
Sure, we have a lot of positive outcomes with this, using this model. We have 1.5% of our caseload has a substantiated case of child abuse or neglect, so that's really low. We're really excited about that. Almost all of our moms and babies are linked to a healthcare provider and have health insurance. And over 90% of our moms initiate breastfeeding, which is a huge success for us.
Definitely. Now tell me about a typical client that you might see.
Well, we don't have any typical clients. We serve single moms, we serve married families, grandparents as parents, teen mothers. We have families that speak 15 different languages, so quite a diverse background in the families that we serve. There are no income restrictions for our program, so it's a very diverse group that we serve.
Okay, well, you mentioned income requirements, so what does make a person or a family eligible for this program?
So eligibility for our program, our families need to live in Lincoln or Lancaster County, within the city limits or within the county limits. We typically like to start seeing families when they are pregnant, so during that prenatal period is when we see the most success, but we will see families after birth up to about 3 months postnatal.
Okay, very good. Now, how do families enroll in this program?
So if anyone is working with a family that they think might be interested in our services, they can call or visit our website. Families can also self-refer. We work with a lot of local agencies and providers, and we have good partnerships with the hospitals, so a lot of our referrals come that way, but anyone can self-refer or refer a family that might be interested.
Okay, very good. Let's talk to Janel for a minute. How often do you see a family once they're enrolled in the program?
Well, initially, the majority of our families, when they enroll in the program, are pregnant, and so we will see them at least 2 times a month. After baby's born, we can move into weekly visits and do that for about 6 months. And after that, we'll kind of start backing down the visits to a couple times a week, maybe even monthly, and then quarterly.
Okay.
That's kind of flexible too. We always decide on what's best for the family. As we talk and meet with the family and decide together what's going to work best for them.
Okay, what are some of the activities that take place when you're on one of these home visits?
We do utilize a curriculum. In the curriculum, we have a lot of prenatal activities that we can do with them, many different topics, things that cover safety, child development, parenting, and we also have activities that we can do with them after the baby's born as well. We do ongoing screens with our families. The screens include substance abuse, depression screening, child development screening, and also looking at family violence. We'll do lots of different fun things too. We might bring out some painting activities and other hands-on child development activities we can do with the kids. One of the big things that we do with our families is family goal planning, learning about what the families are wanting to focus on during the times that we work with them, and we'll make goals and focus on those. And then we'll also, we can also do many different things with them in accessing resources, applying for housing, economic assistance, school applications, etc. The biggest thing to remember for our home visits is that not 2 visits are the same, and they're very flexible. You may have an agenda when you go out to the home, but you might walk into that door and they have some needs that have arose, and we have to focus on that for that day.
Sure. Now, how long would a family typically be involved in the program?
Sure. Typically, we will see families for up to 3 years of age. Now, during that time, they might be looking at attending other early childhood programs, Head Start, preschool, and so they may transition out of the program. We do have the ability to serve children till the age of 5, and many times our families may have new pregnancies while we're seeing them, and so we may extend our services to them, to those other children that are being born too.
Okay. Now, what sort of client feedback have you heard about the program?
We recently just conducted an anonymous client survey, and in that survey, 97% of our clients were either satisfied or very satisfied with our services. And they also reported that they felt that their home visitor was very respectful of their home and their culture. They also reported, about 80% of them, that they felt the services they were receiving had helped them to improve their child development skills, learning more about child health issues, and also just finding more social supports for themselves.
That's great. Now, what do you enjoy most about working with these clients?
I would say that for me, being a home visitor, I love the relationship building piece that I get to form with these families. Every family has their own issues that they're working on, and to be able to get in there and to provide education, to provide support, help them access those resources, so those families are able to succeed is so rewarding and very beneficial to those families.
Very good. All right. Now, Kodi, where can people go to learn more about this program?
So they can visit us on our website for Lincoln-Lancaster County Health Department, or they can give us a call on our referral line, and one of our staff will be able to help them walk through the referral process.
All right, great. Well, thank you both for joining me today.
Thank you.
Stay tuned for some simple ways you can bond with your child over a book.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for Healthy Lincoln wants to help you and your family live longer, healthier lives. It's easier than you think. Take the dog for a walk, play more and text a little less. Swap out a soda for water once a day. Keep fruits and veggies handy for snacking. For more ideas, visit healthylincoln.org.
Literacy is one of the greatest gifts you can give your child. Infancy through age 8 is the most important stage in your child's early literacy development, when they learn and develop the skills needed to be successful in school and later in life. But the bond created while reading to your child at any age is priceless. As we take time out of our hectic schedules to give our children quality, undivided attention, this shows them they are important. Reading with your children gives you the opportunity to establish a strong and nurturing bond. Try to make reading together for 15 minutes part of your daily routine. Here are some tips. Birth to 1 year. Hold your baby close and read. Talk and sing to him. By 6 to 12 months of age, your baby will sit in your lap, look at the pictures, touch the book, and put the book in his mouth. Use board books and point to and name the pictures for your baby. 1 to 2 years. Your baby might enjoy choosing the book from the shelf, sitting and holding the book, and turning the pages. Follow your child's interest in reading for as long as the book holds his attention. Ask, "Where's the doggy?" and let him point to it. Ask, "What does the doggy say?" and let him respond. 2 to 3 years. Your child will be able to handle books with paper pages. She understands how the pictures go with the story and may look for her favorite books and favorite pictures. Be prepared to read the same book over and over. Ask her questions about what's happening in the book and relate the story to her own experiences. That truck looks just like the garbage truck that comes to our house. 3 years and up. Your child will be able to turn pages one at a time. He can listen to longer stories and retell familiar stories in his own words. He will also start to recognize letters and numbers. Ask him questions. How many balls are there? Let's count them. Encourage him to tell, draw, and write his own stories. Visit your local city library to learn more about free library cards, free kids activities like story time, and more.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, get active, eat healthy, and stay informed.